Hi, this is Jenny Bear of Living Well Dallas here chatting it up with Dr. Carol Villanueva of Living Well Dallas. And today we're going to talk a little bit more about FLT and what that is. So, break it down for him, Dr. V. What is FLT?
Sure. FLT is first-line therapy. So we talk about people needing first-line treatment when they come in with a medical problem. Diabetes, high cholesterol, hypertension, high blood pressure. First-line therapy. What do we do first? We all know the best thing and the first thing you should do is lifestyle modifications. So FLT, or
nobody wants to do
therapy,
that.
It's hard to do. It's the hardest part. But that's truly what the first line of therapy should be. Mm-hmm. So this is a lifestyle medicine program. And it's a 12-week program designed to help guide you through the lifestyle changes. So it's a 3-tiered program, 3 tiers, all of equal importance.
Okay.
We focus heavily on the nutrition portion. But of equal importance is exercise and stress management. Mm-hmm. So from those 3 tiers, we in this design 12-week program, you're taught and guided how you can take steps to make this change a true lifestyle change, and to learn about how you can use food as medicine. Mm-hmm. Also, part of that is supplements. And specifically what's called a medical food. It comes in the shape or form of a powder, much like a protein shake or protein powder, but it's truly a medical food, meaning that it's FDA acknowledged as a type of food that you couldn't eat naturally in food, but that acts like food. That has medicinal properties, and there's a whole bunch of different medical foods. So our job as your doctor is to pick which medical food throughout this program would work well for your particular medical problems.
Let me ask you this. So with the medical food, is that something that you could get like at a GNC or
Great question.
Like a supplements store?
Great question. No, it is not. It's what's called nutraceutical or pharmaceutical grade medical supplement, meaning that it has to come from a healthcare provider. Okay. It's sort of they're working on getting them to be prescription actually, but right now it's sort of in between a supplement or a vitamin, so to speak, and a true prescription medicine.
Gotcha.
So it's kind of that middle grade, but yes, you need a healthcare provider to prescribe it for you.
And somebody that's trained in FLT, or first-line therapy.
Correct.
And actually, just so you know, a little sidebar, audience, is many of our practitioners, a lot of our practitioners, even some of the body workers, counselors, life coaches, nutritionists, the docs, our chiropractor, Dr. Lizzie, we've all actually been through the FLT training, which is really cool. So then we're all sort of on the same page about, after the docs put somebody on an FLT program, how we can all sort of leverage and support that person going through the program.
That's right, and that's one of the incredible advantages of Living Well, that the framework from each provider here, the component, there's providers here that are focusing much more on the stress management component. There's some focusing more on the nutrition component. There's some focusing more on the exercise component. So remember, all 3 of those tiers are of equal importance. Different individuals struggle or challenge with different pieces of that when changing their lifestyle. Right. But because so many people here, all the providers are certified in first-line therapy, we're able to give you a very well-rounded approach and help people through their specific challenges better.
Right. So for FLT, give us an idea of what people might eat, because, I don't want people to get the wrong idea that FLT is this diet, sure, that you only take on for a certain amount of time. Sure. When I go through the program, I only eat this way. So tell us a little bit more about, how you might eat this way while you're in the program, sure, and then how you might carry some of those things on afterwards
Sure.
for the benefits of your health?
Sure, absolutely. That's a great question, and truly, it's not a diet. It's truly a fat loss program. We follow your body fat analysis through what's called a bioimpedance analysis. So we follow your body fat, and we know that you're losing fat. It is truly a fat loss program. But the reason why I say it's not a diet is because we are talking about this in the sense of it being a lifestyle change. Right. So the idea is to educate and empower you to understand food differently and be able to use food as medicine. Mm-hmm. So it's based on a modified Mediterranean diet. Most people, in terms, you think of diet, you think of very calorie restricted, you can't eat a lot, you don't have a wide variety of foods. Mm-hmm. That is not the case with FLT. Almost everybody that goes through this program says, man, I had a hard time eating all that I'm supposed to eat.
I can't get all my vegetable servings in.
Exactly. Yeah. So I've never heard of anybody complain of not having enough food.
No, absolutely not.
It's truly just having the right food for your body and allowing your body to do the work that it needs to do to heal itself or to stay healthy if you're already in optimal health. The studies that were done specifically on FLT were geared towards people with what's called metabolic syndrome, which is like a precursor to type 2 diabetes. So that's problems with high blood pressure, high triglycerides or high cholesterol, and blood sugar management problems. So a lot of people can individually fall into some component in that category, but it's also known to improve things like reflux disease or osteoporosis, or people that are healthy love the program to understand how they need to eat to stay healthy and to prevent disease. So through modifications from the supplement perspective and the medical food perspective, truly this is a foundational lifestyle medicine program that can be used for anyone.
Let me ask you this, because I've heard lots of really great stories around here about people getting off some of their meds, some of their diabetes medications, some of their blood pressure medication. Of course, when they're within the right ranges. But give us some of your best testimonials about people going through the FLT program and what results they had.
Sure, absolutely. That is
not to put you on the spot, but recall.
That's right. No, that's okay. It's not hard, because I can't tell you how many people I've seen in the last several years of doing this that we have successfully gotten off of all their blood pressure medications, off of diabetics that have already been diabetics that have cut their medications in half, if not necessarily even within 12 weeks. Sometimes we extend the programs or the maintenance phase, so to speak, of the lifestyle medicine program, if depending on how extensive the disease was at the start. We can't always fit it in this sort of 12-week program. Some are a little bit more extended, especially if you're an insulin-dependent type 2 diabetic. But we've even seen people that were insulin-dependent diabetics recover function of their pancreas and be able to come off of insulin.
I know, it's really amazing.
So it is truly, truly incredible. And there's no medication that can do that. So this has been, fascinating from my perspective, a true pleasure to be able to work with patients in this way. And the feedback that we've certainly gotten from our patients is that they love the way they feel, and they're so happy and thrilled to be coming off of their medications. I've never, ever had anybody with heartburn or reflux disease at the onset of FLT continue to maintain reflux disease after they complete FLT. We've seen improvements in folks with osteoporosis on their bone density. We see drastic improvements in their bone density score, if not, moving them from osteoporotic to osteopenic, or osteopenic to normal bone density. So we've seen a lot, and I don't think we've had anybody that has not had some decrease in their prescription medication intake.
Right. Which is so amazing when you think about, because a lot of times people think, okay, I've got diabetes, I'm going to have diabetes for the rest of my life. It's a sort of a end-all-death statement,
That's
sentence is what I meant to say. And that's not really the case.
That's exactly right.
And I love the FLT program because the number one killer for men and women, different age groups, but is heart disease.
That's right.
And it's not necessarily cancer, even though it seems to me that the cancer people tend to have more fear about, even though we see different levels of people with blood sugar issues and heart disease, that we see it all the time. And we can really do something with that.
That's right.
From the lifestyle medicine approach, which is exciting.
It is exciting. From a provider perspective, that's one of the most exciting things for us, because truly from the traditional medicine perspective, your only option is to medicate, which does not do anything to the disease process itself. It does not get to the root cause of disease. It does not affect that. It just makes blood sugars or labs look better, or at goal, and that's the way that we're trained. But truly with lifestyle medicine, you're getting at the root cause of this disease, and you're fixing it. You're reversing the actual disease process, which is truly fascinating to be able to see that and do that for people. And diabetes is considered a coronary artery disease equivalent. So we are treating heart disease with this program too, directly and indirectly.
Right. I love it. Okay, so we could talk about FLT all day, so we're gonna end this segment here because I would like Dr. B to maybe touch on labs and allergies related to when you're sort of doing your FLT workup in the next video. So thank you again, Madam.
Thank you.